Last week we heard about the death of Robin Williams, a man who made all of us laugh at one time or another. But little did anyone know that he was suffering from severe depression other than his immediate family. And of course, Robin Williams covered a lot of that with his comedy. I, Mark Prater, have at one point struggled with depression and actually had to get it treated. And the reason I'm talking with Dr. Josh today is to look for some of the signs and symptoms, what to look for family members as well as relatives and distant coworkers. What do we look for?
Well, the first thing, let me say, the fact that you're talking about it is probably one of the biggest advances that we can have when it comes to depression, because it's incredibly common. It's as debilitating, Mark, as having diabetes or hypertension. And yet, if you had diabetes or hypertension, you'd have no problem talking to your doctor about it. So one of the biggest problems we have with depression is people are afraid to talk about these symptoms that they very often have. And when we have loved ones who we think may have depression, we immediately want to pull back and say, well, it can't be that because that's particularly bad.
It is a chemical that is changed in the brain. That is basically what it is. And the reason why I'm telling people that I've battled it before is so they realize, hey, it's not just me. And, you know, look at Robin Williams or a weatherman on TV. If you watch people, you think their life's wonderful, nothing could go wrong, but that couldn't be further from the truth.
The first thing you got to understand about depression is it is not the same as just being down or just being sad. And I think, as you know and as you've experienced, when someone gets into a clinical depression, the feeling of hopelessness, the physical feeling of lethargic, of fatigue, of not being interested in anything, it's not something that you just shake by someone telling you to be happy. And that's really a big difference between feeling down, which we all feel, and this very much this condition, this disease that can be treated. And that's the other important thing, Mark. It can be treated in most people, but you have to go for help.
That was one thing that I'd struggled with to begin with. I'm thinking, I can't do that. I'm a TV personality. But again, it was important to get me straight so my family could have a normal father and husband. I did do that. I took the steps. I went and talked to someone. I started with a certain medication to help a little bit. Those are things that you don't need to be embarrassed about.
No, and this is the thing. When you think about depression, there are so many people out there, people that you may be working with, people that in your family, people at your church who may be suffering with this, who are very often are getting treatment. The problem is they may not be talking about it because it's depression versus if they had diabetes or hypertension. So we get caught in this sort of problem where everybody thinks nobody is suffering from it. If you've got family or friends, or for yourself, if you're feeling down, if you're feeling sad, if you're having a hard time sleeping, if you kind of feel like I just can't get myself interested in doing anything, or more seriously, if you're thinking like life isn't worth living, there's no hope, those are the signs, particularly if they've lasted more than a couple weeks, those are the signs of clinical depression. And the best thing you do is you go to your primary care physician or a doctor or a mental health professional. You simply tell them about those symptoms like you would any other condition.
Family members, friends, people who hear from someone who said, hey, I'm depressed right now, I feel horrible, what would you suggest to them?
Well, the first thing is we all do get down.
Sure.
And if you say I'm feeling depressed today or it's been a bad couple of days, then as a family member you do what you would normally do. Talk to me a little bit about it, it's going to be okay. But if you have a family member who's been that way for a couple weeks, then really the best thing you can do is not try to talk them out of it, is not try to cheer them up, is to take them to a medical professional or a mental health professional and simply say, look, let's just go get it checked out.
Right.
May or may not be depression, but let's go get it checked out, because if it is, you can manage it.
And that's exactly what I did and a number of other people have done. It does make a difference. You've got to take your pride, set it aside, and realize it's a chemical issue. It's something going on in your brain. It's not an ego thing. It's something that is going on physiologically with your body. And unfortunately, we do see things happen like what happened with Robin Williams. And we want to avoid that. This was a huge wake-up call. Somebody, it was so beloved, so funny, little did we know.
I can tell you this, Mark, as a psychologist. If you go to work, if you go to church, if you go to school, if you look around, there is a very good chance that one or more people that you work with is suffering from depression. Some it may be treated, some it may be untreated. Don't assume just because everybody looks okay from the outside, as you did when you were on TV, as Robin Williams did. Don't assume that that means that everything's okay. You need to understand what's going on their entire life. And so if it's a coworker, you may never know. But if you see changes in that coworker, if you see changes in the mood of a family member or friend, then it's time to ask. Don't be afraid to ask. Worst thing they can say is, I'm doing okay, or worst thing they can say is, I've had a bad day. If it's worse, if it is depression and it's untreated, unfortunately, in some cases, it can be lethal.
Don't believe that everybody else's life is wonderful all the time and mine's terrible. Everybody has struggles, family, illness, job, whatever stress it may be. It's vitally important, and that's why I want to speak out and let people know it's okay to maybe go talk to somebody and get the help like Dr. Josh is. Thanks so much for being with us.
Sure, Mark.
All right, thanks so much.